I have to tell you, in all my years of doing talk radio, and I've done radio for over 40 years now, 42 years I've been in radio, I don't think I've ever quite met a couple like we've got coming up next. Dr. Bones and Nurse Amy are real medical professionals. Dr. Bones is Dr. Joe Alton. He's a medical doctor and a surgeon. And Amy Alton, his wife, is an advanced RN practitioner and midwife. And they specialize in disaster preparation, but they are so much more than that because they are YouTube stars, they are authors, they're podcasters. I'm surprised they're not on stage singing and dancing. So welcome to Dr. Bones and Nurse Amy to WHO Radio.
Hey, Steve, who says we haven't?
Maybe you do a song and dance. I don't know. Do you?
He could do the song and I'll do the dance. Yeah, that would be perfect.
Yeah, I listened to your podcast. They are just fascinating. And then I watched your videos. It's incredible. We should introduce you to people, though. Maybe you can both explain your backgrounds real quickly.
Well, I was a nurse. I went to an all-women's Catholic nursing school that was run by nuns. So I had quite the nursing education. Then a couple of years later, I decided to become an advanced registered nurse practitioner and a certified nurse midwife. It was a dual degree from University of Miami. And I finished that one in 94, but I finished nursing school in 87. That was a long time ago.
Fantastic.
And I'm a fellow of the American College of Surgeons and the American College of OBGYN. I delivered thousands of babies early in my career and sort of morphed into sort of a pelvic surgeon and laparoscopist, sort of a belly button kind of surgery kind of guy towards the end of my career. Both of us are now retired, and we devote ourselves entirely entirely to medical preparedness.
Yeah,
it's amazing. Their website is called doomandbloom.net. So DOOMANDBLOOM.net. And we'll talk a little bit about that in a little bit here. But try to explain to people what you specialize in. It's kind of different, isn't it?
Yeah, absolutely. We write and talk about pretty much what you would consider to be a lot of common medical issues, first aid and dealing with illnesses and infections, but we do it with the twist. We assume that there's no doctors, that there are no hospitals, because some disaster has occurred that has made them unavailable to you, whether for the short term, like after a tornado perhaps, or after a hurricane, or even in the long term, if there was let's say, electromagnetic pulse or solar flare or something like that would actually take away the grid. So we try to empower the average person to become a medical asset for their family. Our mission is simple: to put a medically prepared person in every family.
You actually want people to become effective healthcare providers themselves, right?
We do for times of trouble. That doesn't mean that I want to see somebody bring me their 8-year-old daughter and show me the top of their head and say, "Here, look at the great stitching job I did last week, Doc."
Just understand that we go see doctors, we go to hospitals, and when our adult children who don't live at home get sick and call us, we say, go to the hospital or go to the doctor. This is not about avoiding going to a hospital. It's just we want to let people understand that there are things you can do if you have to.
Right. And there are emergencies, disasters that occur on really a weekly basis: floods, tornadoes, hurricanes, earthquakes, epidemics. There are so many things that occur. There's always that chance that you might be affected.
Yeah. We, of course, have to talk about Ebola, and Dr. Joe just came out with the Ebola Survival Handbook. Saw it on Amazon just this week. It's out fresh, so we'll talk about that. And, of course, their big book is called the Survival Medicine Handbook. It's over 500 pages, fascinating tips on how to survive in times when you may not have that medical help around. And let's hit some of these topics. Dr. Joe Alton and Amy Alton, let's talk about winter dangers first, since we're up here in cold country, and man, it was cold this last week. So what do people do to help survive like hypothermia?
Well, I'll tell you that the National Climate Center of NOAA, they actually said that 7 states, including the state of Iowa, had a top 10 coldest winter, and that's ever since they kept records, I think, since 1895. So it has been cold, and they expect it to be a very cold winter there as well. And so there are a few things that you should do to make sure that you can avoid getting yourself in trouble from the cold. And it's actually pretty easy to remember some of these tips. Just think of the word cold, C-O-L-D. Now, C stands for cover. You want to protect your head by wearing a hat. You have a lot of body surface area on your head, and if you can wear something to cover it, that's going to help prevent body heat from escaping.
Okay, what about I wear earmuffs. I don't wear a hat. Is that okay?
Well, you're certainly covering your ears, but you have a lot of space on your head that isn't covered, if that's the case.
Well, thank you for saying that. I appreciate you complimenting me that way.
So you know what because you have a big brain.
But at least,
Steve.
at least he didn't say you had a lot of space between your earmuffs.
All right, there you go. That's the important thing. So we have to protect that very precious brain of yours. That society demands it, and so you should be putting on, of course, a hat. Now, of course, instead of wearing gloves on your hand and to cover your hands, you should probably use mittens, because then the fingers can actually touch each other and keep each other warm.
Seriously,
mittens are, absolutely.
You're talking about a grown man? A grown man supposed to wear mittens?
Yes.
Wear mittens, absolutely.
Yes, and then try to do your iPhone.
Yes.
Use your smartphone
Oh my
with
gosh.
mittens. I know, but it does, keeping your fingers together keeps them warmer.
Well, I've got to tell you, it went all the way down to 56 degrees today down where we are, and so we had our mittens out, and we had our half parkas and our mucklucks. And
I bet.
It's been pretty bad down here in South Florida, I'll tell you. So anyhow, that C is for cold. Now, O is for overexertion. You want to avoid activities that cause you to sweat a lot when you're in the cold. Cold weather makes you lose body heat quickly, and wet, sweaty clothing, man, that accelerates the process.
Okay.
So that's very, very important. L is for layering. Of course, you want loose-fitting, relatively lightweight clothing, but in a number of layers that can help insulate you well. And, of course, you want clothing made of tightly woven, water-repellent fabric. Wool, silk inner layers are better than cotton, I'm sure you know that. And D, C-O-L-D, keep as dry as you can. Get out of that wet clothing as soon as you possibly can. It's just very easy for snow to get inside, gloves, boots, things like that. You got to pay particular attention to your hands and feet, which are some of the first things that are damaged if you're out in the cold.
So if you're stuck out in a car, because this is what happens up here, we get a blizzard and all of a sudden people go into the ditch and you're stuck in the car for a while, you're basically saying stay put, don't move, because one of the worst things you can do is start to get moisture and get colder.
Absolutely. You know what? It's like they said in World War II, is this trip necessary? And if you don't have to get in your car in a blizzard or a snowstorm, don't, period. But if you do, you always have to make sure you drive as if your life depended on it, because believe me, it does.
Great.
Now, if you're stranded, let's say you are stranded, you're stuck on the road in a blizzard. Now, help might be on the way, but what if it isn't? You have to stay calm. Don't leave the car. Remember that it's warmer there than outside. There's actually some people that got stranded in their car, and they went out, or the husband went out and left his wife and child inside, and he actually wound up freezing outside. So that is something that is a big problem.
Yeah.
Even though you have to stay inside, you got to crack a window on the side other than from where the direction of the wind is going, because otherwise carbon monoxide can certainly build up in your car, and you know how dangerous that can be.
Okay, Dr. Joe Alton and Amy Alton, our guests today. Doomandbloom.net is the website. You mentioned in the book that you can actually suture yourself and even staple your own skin, and I saw on your website that you actually train people to do this. You hold sessions to do this. You really think people can get to that point where they have to do it? What kind of situation would that be?
Well, very, very simply, in a situation where there is never going to be a hospital available to you, where there's never going to be a doctor available to you, and that you are the end of the line with regards to whether someone gets better or not. Now, I'm not sure you can suture yourself, but you could wind up having to close a wound on someone else. And it's very important to know which wounds to close, which to leave open. And we not only teach how to close wounds, but we teach you what to do with open wounds and what to do if that wound should remain open and heal from the inside out, which will be a lot of them. You know, in survival, a lot of wounds are going to be dirty. You're not going to want to close them.
But stapling? I mean, I know the doctor can do that, but I don't feel comfortable doing that.
It's a matter of desensitization.
Training, right?
That's right.
It's all about safety and knowing. And a lot of these wounds will end up being left open anyway, because how are we going to injure ourselves? Probably with dirt instruments, things we've chopped wood with, or maybe butchered an animal. They're not going to have just come out of a freshly cleaned, sterilizing dishwasher. So a lot of them are just going to be left open anyway.
And taken care of that way.
Dr. Joe's book came out this week called The Ebola Survival Handbook. And I don't want to spend a whole lot of time on this, but wow, there's a lot of controversial areas we can get into with Ebola. I guess the first question for you is, how scared should we be? You're medical professionals. How scared should we be of this?
Well, I don't think in the United States that we have to really be scared at all at this point. There hasn't been a community-wide outbreak. The contacts of the people that have gotten it in the United States, the very few people that have gotten in the United States, have all passed quarantine successfully. And the only people that have died from the disease in the United States are nationals from other countries who came relatively sick or at the point where we weren't quite yet ready to deal with their particular issues. So I think that at this point that we've learned from our earlier mistakes. I think that we have the ability to deal with a certain number of Ebola cases in one of the 4 high-level containment areas, one of them in Nebraska, another in Montana, then, of course, the NIH in Maryland, and the CDC in Atlanta.
Now, I looked on your website, the doomandbloom.net, and if I recall correctly when I watched your video about Ebola, I think you actually recommended that we stop flights from Africa and that we not bring these people into our country to treat them. Am I remembering that correctly?
Yes, I actually made a statement to that effect. At that point, we were in a situation where Ebola was ramping up quite fast in West Africa, and we were having some very active cases in the United States. We had just had the 2 nurses get infected as a result of treating Thomas Eric Duncan. And so I felt pretty strongly at that point. At this point, I still feel that some kind of quarantine may be appropriate, but there's always that battle between civil liberties and public health. That's an eternal battle that we've been fighting ever since we figured out what causes infectious diseases.
Yeah. Now, Amy, I was curious with you, since you're a registered nurse. You saw what that Maine nurse went through with the state government and how they were trying to keep her quarantined and all that. What was your reaction to that? And what do you think from a medical professional standpoint should be the guidelines that a medical professional has to follow in that case?
Well, frankly, since I care about the health of others around me, and that's why I became a nurse, and that's probably why most people become healthcare workers, it made absolutely no sense to me why this woman wouldn't just quietly go to her house and hang out and watch cable. I mean, there's, 700 channels on cable television these days. You can rent movies. she's got a boyfriend, he or fiance or something. He could have gone out and gotten pizza for her. I mean, hey, a forced vacation, sign me up. I have no idea why she made such a big deal of this.
Well, she was kind of a rebel. You know those nurses, they can be rebels.
But
right, Dr. Joe?
Yeah.
They have a one-track mind.
Yeah.
Boy, don't I know it. But
Yep.
the one thing I just want to say about this is a person who signed up to deal on a daily basis with the vomit, the blood, the feces, the urine of Ebola patients. Yet she felt put out by being asked to stay in her home for 21 days.
Yeah. And that's what I appreciate is your honesty. I appreciate it on the website. That's why it's so fascinating to see that you can go from something goofy and giggly to something very serious. The books are pretty serious, I would say. I haven't seen the Ebola book that came out this week, the Ebola Survival Handbook, but I assume that that's a very serious discussion of the topic and practical tips. Just reading the Survival Medicine Handbook is just filled with so much stuff. And the ratings are so great. When you see the reviews on Amazon and stuff, people just praise this thing. It's something that's really needed. It's one of those things where we don't think about it until we need it, right? A lot of us don't think about it on a day-to-day basis, but suddenly we get stuck in a situation and all of a sudden we've got to have something in an emergency.
You're absolutely right. And we depend on high technology, and we depend on all the good people that are paramedics and nurses and doctors and hospital personnel to take care of us. But there are some circumstances and disasters that can occur in which that kind of help may not be available. Sometimes the ambulance is heading in the other direction. So It just makes common sense to be able to deal with some things yourself.
Now, are you part of this movement, the preppers movement, where you're kind of preparing for bad stuff that's coming up? Are you part of that?
Well, I would say that living in South Florida and having both of us experience Hurricane Andrew, if we're not part of it, then we're not real bright.
Okay. So you've got to be prepared.
Yeah, it makes sense. Depends on where you live. If you live through tornadoes, you need to have a storm shelter. If you live near earthquakes, you should have a safe place in your house to know isn't going to fall down on top of you. It just makes sense for us to be prepared for hurricanes or whatever.
Sure.
Now, having said that, we're not wearing camouflage at the moment. We are not in a bunker somewhere underground.
I hope I'm
I've seen your videos. You do your videos in a tent, right?
Yes, the hospital tent. Yes.
Yeah, hospital tent, like the MASH unit or something. It is funny to watch.
Yeah.
But
exactly.
You also,
well, I mean, and that sort of gives the feel of we're doing this because there isn't a hospital. We are in no way, shape, or form asking people to replace your doctor or your nurse practitioner or your emergency room with our book. Please, that is not the goal. This is strictly safe emergency care only.
That's interesting.
That's right.
You go in the book through kind of a little history of preparedness, and you go back to biblical times, and you talk about Joseph in the Old Testament, and so we might as well tie that in because that's all about preparedness too, right?
Absolutely. Joseph foretold that there was going to be 7 years of plenty, followed by 7 years of famine, and so they saved the country of Egypt by gathering wheat and grain so that there would be enough for those 7 lean years.
They stored food. I mean, it makes sense.
It's as old as time.
So can I quote you saying that Joseph was the first prepper?
Yes.
He could have, but we don't know who went before him who did.
Well, that's true. That's true. I just like to give you a hard time. It's just so much fun. Yeah, when folks go to your website, the doomandbloom.net website, you just have so much fun. And we don't want to act like you take serious subjects and twist them. You don't at all. You can treat them very seriously. But you also have fun with each other, and you're very playful. The question, obviously, is why did you call it doomandbloom.net?
Oh, Well, I can tell you that we are involved, or we were involved in the Master Gardener program for the state of Florida. And so we are active gardeners as well for medicinal herbs and also food. We actually are growing right outside of our yard here.
In the neighborhood, by the way.
In the
I
neighborhood.
do not have a farm. I wish I did.
Right. We have a winter garden here, which is something that you can have in Florida. We have multiple growing seasons. And so we have lettuce, we have radishes going right now, snap peas, tomatoes, peppers,
wow.
right? All sorts of stuff that are growing right now in our garden.
We also have sugar cane.
And we have sugar cane. Well, that's how far south we are, ladies and
So
gentlemen.
the doom and bloom basically is doom. Bad things can happen, but the bloom part is if you're prepared, if you've thought about it, and you have some plans, you'll be okay.
That's
so
good.
Doom and bloom.
That's a good message. When we come back, we're going to find out about the biggest video that they've ever put out. And it isn't about medicine. It's about cucumbers. So we continue on News Radio 1040 WHO.
Newscasts and status updates all through the day. That's why it's called News Radio 1040 WHO.
This is Stephen Winzenburg. I'm a communication professor at Grandview University in Des Moines. Thanks to Karsten Lundy for producing the show today, and Dr. Bones and Nurse Amy are the guests. The website is doomandbloom.net, and as Amy just so eloquently talked about, how we're talking about both the surviving the disaster, but at the same time growing things. And I looked, and it looked like there were about 240,000 hits on your video of how to grow cucumbers. How is it that so many people need to know how to grow cucumbers?
You know, I have no idea. Like I said before, we live in a regular neighborhood. We have houses, pretty close to us, like most neighborhoods in suburban area. And I was forced, because of our soil being so bad down here in South Florida, to grow in raised beds. And what I did was I just bought the storage containers, the biggest storage containers that you can get from the big stores. We won't name them. And drilled holes in them, filled them up with the best organic soil I could find. I was composting at the time. And I started having success. And I thought, well, I should teach people that they can grow food without having a huge farm. It's around my pool. It's on my patio. Not very big. And, just the basics of how to grow food in containers.
And it certainly doesn't hurt that you're absolutely gorgeous.
Oh, stop.
She is cute. I have to admit it. It's cute to watch her do that. Yeah.
I'm passionate. I'm very passionate about growing food. Passionate about everything.
So how has that been for you two? I mean, this is a whole new life for you two. You're medical professionals, and all of a sudden you're YouTube stars and you're authors and you're doing a podcast. I mean, this is a whole new life.
I have to tell you that never in our wildest dreams do we expect to be on this path. It strictly started off as, wow, Hurricane Katrina came and we experienced Hurricane Andrew, and we need to teach people. So we had no idea about a website, so we did a blog spot. So we started writing. People said, gee, my ink cartridges cost more than if you guys would just write a book, because they were printing all of our articles that we were writing feverishly. And so we sat down and wrote a book. I think it took 9 months, night and day. And then we kept writing, and then wrote the second book because we've been writing so much more. And then people said, you give us these great ideas of what medical supplies to get, but could you make kits for us? So I designed one kit, and then I designed a second, and a third, and a fourth. And then it turned into DVDs because we would speak at different conferences, and people would want to take home the talk or an expanded version of it, since we would be able to talk for 2 hours, and sometimes we're limited to an hour. So it grew. It grew organically. That's how our life has
It's
moved.
amazing. And one of the things we haven't mentioned is you even have a board game.
Yeah. Oh, yeah. And by the way,
Now, we really didn't want, this can be very serious stuff, but we felt that it was just difficult for a a person who was interested in disaster preparedness to actually get the whole family on board. Of course, a lot of the younger members of the family may find this stuff very boring. And so we figured out a fun and challenging way to get people around the table, get the whole family to look up from their cell phones, get around the table, and play a game that involves making the tough decisions that go into survival. And we call our game Doom and Bloom's Survival. And in it, you live in a post-pandemic world, and you go out into the world. You find fuel, food, weaponry, medical supplies, and scout out locations that could serve as a settlement to call home. And it's been a lot of fun. It always seems to come down to the last couple of turns, and I think it's a great Christmas gift for anybody who wants to get the whole family on the same page when it comes to disaster preparedness.
Yeah, you just got so many amazing things, and it's hard to hear you say that you're retired, because there's no way you can be doing all these things and be retired. That's amazing to me.
Well,
it is night and day, and it's the funny thing. We never thought this would happen, and pretty much 7 days a week we're at morning, noon, and night doing something to help people, either filming a new video that's educational, or writing an article, or researching an article, or doing these fun interviews with you, Steve.
Thanks.
Absolutely.
You enjoy this.
Well, let me ask, I got to ask, there's one side of this I do want to finish up with, and that's that you probably, because you've made yourself so public now, you probably then get some flack back, some negative feedback. What has been the toughest thing to deal with from that standpoint?
Well, I think that people consider us as preparedness experts the same thing as what you see on TV in these shows like Doomsday Preppers and things like that.
Which couldn't be further from the truth.
It couldn't be farther from the truth. And the truth of the matter is that people that take the time to prepare, to have a little extra food in their cupboard and have some medical supplies in case they were in a disaster, to have some stuff in their car that might help if they were stranded during the winter. These are not crazy people. I mean, I think it just is a common sense to want to be ready for any of the slings and arrows that life may throw at you. And we are just not the type of people that you see on TV that are shooting guns all over the place and blowing up.
Right. He got interviewed today from a newspaper, and one of the questions she asked you was what?
Yeah, she asked, "Am I wearing camouflage?" and
really? He's like, "No, I'm not wearing anything."
yeah, I'm totally naked right now talking to you. Yeah.
You should really you should have a reality show. You too, because I've watched enough of your videos now where you're just that kind of couple where it would be fun to follow you around all the time and see what you do.
But you'd have, oh boy, no, it would be too crazy, because we're very, when I say passionate, we're both type A personalities, and it was hard enough. We met because I worked for him. So he was the boss, I was the employee. Then
she's the boss.
Wait. Then I had to deal with
now she's the boss. I got that. Yeah.
Yeah. He says that with tongue in cheek. Then he's the
Dr. Joe.
Dr.
Joe. Here's what I learned in life: nurses always think they're the boss.
And they are, believe me.
Oh my gosh! So yeah, it would actually be a very, very entertaining show.
Well. Yeah, it's just been fascinating to see all the different things that you've done. There's so many different things: herbal medicine, how to treat bites and burns, using fish antibiotics instead of medicine. I mean, the book is just filled with all sorts of great information. It's called the Survival Medicine Handbook. What's the one thing you want to leave us with in this last minute that we've got on the show?
I just want to let people know that they can be an effective medical resource for their family in times of trouble, in any disaster, if they just take a little time, a little effort, get some knowledge, get a few supplies. You know what? If Nurse Amy and I can do it, you can do it out there. Anyone can do it. So that is my message. There is no reason why we can't have a medically prepared person in every family.
Yes, and don't be scared. Don't be scared of anything. If you've got some skills, you've got some preparations, you've got some books and knowledge, you'll be okay.
Thank you
It's
for
all
that
gonna be
great
good.
advice. Dr. Bones and Nurse Amy, Dr. Joe and Amy Alton. It's doomandbloom.net, doomandbloom.net. All their great stuff, podcasts, videos. You can check out their books. And, of course, that survival game. This is Stephen Winzenburg, and have a great night.